Good afternoon, everybody. Welcome to the latest City European Social Survey and NatSen seminar. Today we've got an interesting talk on the theme of measuring sex, gender and sexual orientation. And our speakers will be Nancy Bates and Katie Dalke. Before I introduce speakers formally, just to say that if you'd like to leave a question for the speakers, please use the Q&A function within Zoom, and we will select the questions from there at the conclusion of the talk. Nancy and Katie will be talking for about 40-45 minutes, so we hope to have plenty of time for questions. So without further ado, I'll now hand over to Nancy Bates, who's going to kick off the seminar.
Can you hear me okay?
We hear you well.
Okay, terrific. Thank you so much. Well, thank you very much. It's a pleasure to speak to you today. This report is just about a year old now, and we're happy to share our findings. Next slide, please. Just to give you a little bit of context, this was one of the most downloaded, it was the most popular NASEM report of last year. And when it came out, we had a lot of support from the LGBTQ community with over 190 organizations basically backing up our recommendations and really calling for more measurement in the federal statistical system of sexual orientation and gender identity. Next slide, please. So there was really two high-profile publications that emphasized the need for this report. One came out from the Institute of Medicine, and that was basically calling for, again, that the collection of sexual orientation and gender identity should be collected in federally funded surveys. And then on the heels of that in 2020, there was another NASEM report that emphasized the fact that sexual orientation and gender identity questions are presented inconsistently across different data collections. So that was sort of the emphasis for this report. Next slide, please. We had a very diverse committee. Of course, Katie and myself were on the committee. Unfortunately, Kellen was going to talk today, but he was called away on another urgent matter. But it was a very diverse group of people, including folks from the medical field, from the public policy field, from think tanks. So we had a really robust participation. Next slide, please. And suffice to say that these NASEM reports are very, very rigorous in the sense of peer review. You can see all the different peer reviewers that we had there. And these reports are really held to a high bar where everything has to be evidence-based recommendations. This wasn't a matter of a bunch of experts coming together and just doing sort of an expert review, if you will. And this really sharpened up our report. All right, next slide. So in terms of way of introduction, again, sex, gender, and sexual orientation are core aspects of one's identification, and these shape our life outcomes such as health disparities, discrimination, victimization. However, as I mentioned earlier, the data collections in the US at least are not standardized. So unlike other constructs like race and ethnicity, where we do have standards that are put out through the Office of Management and Budget, and pretty much everyone adheres to those standards, we don't have such standards for sexual orientation, gender identity. So the end goal was really to improve measures, to improve the understanding of sexual and gender minority populations so that policymakers and other strategists could use these data. Next slide, please. So fortunately, this was funded by the National Institute of Health, and they really helped sort of narrow down our statement of task, if you will, but it was twofold. The first was to review all of the empirical evidence we had on the measures of, first of all, sex, and particularly sex as a non-binary construct. Also look at the empirical evidence on the current measures of sexual orientation, and then finally gender identity. We were also asked to look across three different platforms, if you will. One was surveys, which is sort of my expertise. The other was in administrative settings, and the final was in clinical settings. But our work product was basically to be a consensus report with guiding principles and recommendations on how to actually come up with these measures. Next slide. So I don't want to spend too much time on definitions, but one of the first things that we learned as a committee, because we were coming from different environments and different contexts, if you will, we needed to come up with common definitions. And that was actually one of the first exercises that we did. We all independently wrote up our own definitions of sexual orientation, sex, and gender identity. So let me just step through these pretty quickly. Next slide. Yes, thank you. So first of all is sex. This is a multi-dimensional construct, which is based on a cluster of different things, including sex traits. In the US, most all infants are assigned either male or female at birth. Now that's changing in some states, but at the time we were writing this, it was really the case that almost every infant in the United States is either assigned male or female at birth. Sex traits are usually assumed to be unambiguous, but they may not be. And we'll talk more about intersex and DSD populations later in this webinar. Sex traits are usually assumed to correspond to the same sex, but they may not. And then finally, sex traits may change or be altered over time. They're not necessarily static over one's lifetime. Next slide. So we do have an entire chapter in our report dedicated to populations defined by sex traits, and Katie is going to talk about this at the conclusion of our webinar. But suffice to say, there's a very large number of conditions that are classified as intersex, and those are covered in the report as well. But I learned a lot. In fact, there's over 30 different conditions that are classified as DSD or intersex. Next slide, please. So the second definition is gender. Like sex, gender is also a multi-dimensional construct. Typically, things are things like identity, expression, and social and cultural expectations. There are some complexities involved here. Usually, gender is often conceptualized as binary, either male or female, man or woman, at least in Western cultures. But we are also aware that there are other categories outside the binary, such as transgender or non-binary. Often, sex and gender are used interchangeably and as proxies for one another, although as we'll discuss later, that's not a good assumption. And again, like sex, gender may be temporally or contextually fluid, and one's gender identity may change over time. Next slide. So some of the gender identities that we talk about in our report, first of all, is transgender, and we use this as sort of an umbrella term for any person whose current gender identity is different from the sex that they were assigned at birth. Now, we made an explicit differentiation here between this umbrella group of transgender to those with a transgender experience versus those with a transgender identity. So transgender experience may be people who would classify it as transgender, but they may not identify with the label transgender, especially if they've already transitioned. They may simply identify as male or female, man or woman. Others, though, that would meet under the umbrella definition may identify with the actual label of transgender when talking about one's gender identity. So we'll talk about that a little bit more in detail. And then we have cisgender people. So these are people whose current gender does align with their sex assigned at birth. And then we have kind of this non-binary umbrella term that might include things like people identify as genderqueer or gender fluid. And we'll talk a little bit about two-spirit, because in the United States, this is an important label or placeholder for populations who are indigenous in North America, who may identify as something other than the non-binary, and two-spirit is a term that is used. All right, next slide, please. And then finally, we have sexual orientation, again, a multi-dimensional construct. And typically, there are three sublayers under the larger label of sexual orientation. And these would be sexual orientation identity, sexual attraction, and sexual behavior. Now, while there's three of these sub-constructs that are typically used to define the larger sexual orientation, our report focused on sexual orientation identity. Not that we don't think attraction and behavior are important, they are, but given our task and time that we had, we focused on identity. All right, next slide. So real quickly, some some kind of common sexual orientation identity labels. The first four here are pretty common and ones that are seen in surveys that may be measuring sexual orientation. We would see these. This is straight or heterosexual, gay or homosexual, lesbian and bisexual. Queer and pansexual, probably seen a little bit less in at least general population surveys. And then the last two down here, two-spirit and same-gender loving, these are specific to race and ethnic groups, at least again in the United States. Two-spirit, again, meaning a placeholder for indigenous populations, and then same-gender loving used primarily among African-American and Black populations. The questioning label used more among youth populations who may not have fully realized what their sexual orientation identity is, so they may use the term questioning. Okay, next slide. So as I mentioned earlier, in our statement of task, we were specifically asked to make sure that whatever measures we came up with would enumerate sexual and gender minorities from indigenous populations, in particular, American Indian and Alaska Native. So two-spirit is sort of this intertribal umbrella term used in the United States that is recognized by most tribes. It's not universally used, but within most of the federally recognized tribes in the United States, this is a term that they're familiar with. And we'll talk more about that in a bit. Okay, next slide. So fortunately, the scope of the report, again, narrowed our limit somewhat, that we were asked to focus on, first of all, the adult population, not necessarily the youth population. So the recommendations that we talk about are specifically focused on adults, and we'll talk about some of the gaps and the weaknesses in that, but that's what we were asked to look at. We were also asked to look at the English-speaking population. So that also helped us narrow down a little bit. And then finally, as I mentioned, we wanted to be sure and prioritize being able to include and enumerate sexual and gender minorities for indigenous populations. Okay, next slide. Okay, so let me jump into some of the principles and measurements that we came up with in the report. Next slide. So the first thing we did was to try to step back and come up with really all-encompassing guiding principles that we could always tie back to. And as we were putting together our measurement recommendations, we could kind of tether back to these 5 data collection principles and making sure that we weren't violating them. So the first one is pretty simple: inclusiveness. People deserve to count and be counted. So we wanted to make sure that everybody would be able to see themselves in these measures that we came up with, and that they be identified and reflected in the data collection instrument. So we wanted to be as inclusive as we could. The second was precision. And this simply means that we wanted to make sure the questions were clearly reflecting exactly which component was being measured. So for example, we wanted to be careful not to conflate sex and gender and never use one as a proxy for the other. The third is autonomy. And this was important because we wanted to make sure that these measures shouldn't require any kind of external authorization, because there have been some states in the United States, for example, that if you wanted to change your gender marker on, let's say, an official document like a driver's license, you might have to have proof from a medical doctor or some sort of a legal court document. And we absolutely did not want that to be part of our recommendation. So autonomy. Parsimony was the next one. And that was that basically we wanted to make sure that the practitioners have a clear need for collecting sexual orientation and gender identity. The data collection is not an end to itself. So before we put it on a survey or an admin record or any other data collection instrument, what is the end purpose and is it really needed? So that was the parsimony. And then finally was privacy. We wanted to make sure that these data collections, while we wanted to encourage and make them as user-friendly, and we wanted people to provide this information, it should always be voluntary. It should never be a must-answer question, for example, in an automated data collection. Never make it a hard edit so that someone can't go forward until they answer it. So make these things voluntary, and of course, always keep all these data private and confidential. All right, next slide. So before I jump into the actual first recommendations, I want to emphasize that we really, throughout this report, we really emphasize the clarity between sex and gender. Conflating sex and gender can definitely lead to measurement or misuse of the data. So we always kept that top of mind as we were working through these recommendations. Next slide. So that said, our first conclusion was that, again, gender, we really think is the construct that determines outcomes in life, including measures of well-being, health, discrimination, victimization, those kind of things. And in most contexts, including human research, we think it was most important to collect gender as opposed to sex as a biological variable, particularly if we're wanting to monitor things like outcomes like disparity. And so this conclusion, next slide, led us to our first recommendation. And that was that the National Institute of Health should be collecting data on gender by default and not sex. Now, we recognize that there are circumstances where biological sex variable does need to be collected, but it's our recommendation that in these situations where it does need to be collected, it should always be accompanied also by gender identity, that these data collections should not be collecting sex by itself. So this was our first kind of major recommendation, was this idea of gender by default. And I will say that when we put our first draft out to those big list of reviewers that you saw, we got some pushback on this pretty strongly, that this was too strong of a recommendation, that to try to instruct the National Institute of Health to make gender by default as opposed to sex. We did get some pushback on this, but we were successful, I think, in making our argument as to why this was important. And this is one very important takeaway from the report, this gender by default idea. Okay, next slide, please. So before I get into the first of the recommended measures, I want to just walk through sort of the criteria that we used in coming up with these. There were sort of, you see two columns here. One was the criteria for the questions, like the question stems themselves, and the second one was for the response options. So in terms of the questions, we wanted to really be able to point to a great deal of empirical evidence that these measures have been tested among wide populations, and not just sexual and gender minority populations, because we were really looking for, again, if you go back to our statement of task, we were talking about the general adult English-speaking populations in the United States. So it was always top of mind that we wanted to make sure that while we were being nuanced enough to allow for sexual and gender minorities to see themselves, we also wanted to make sure we weren't causing confusion among the larger population of non-sexual and gender minorities. So we wanted to make sure that our questions were comprehensible among both sexual and gender minorities and the general population. We also, to the extent that we could, looked for measures that had been tested across different administration modes, again, administrative records, clinical settings, and survey settings. And in terms of the questions, we, as a committee, we did a lot of debate, but we did ultimately recommend that there only be select one response option. And we'll talk a little bit about what that means and how that might be. One could point to this to being some weaknesses, but as a committee, we did decide that these wouldn't be mark all apply, that these would be select one response. In terms of the response options, kind of some of the same criteria. We wanted to make sure that the response option terminology was understandable and comprehensible among all populations, not just sexual and gender minorities. We wanted to be able to track things over time. As we talk about some of the weaknesses of these recommended measures, we'll talk about the fact that terminology changes and it's constantly changing. So we wanted to be able to come up with measures where over time we can look at things that are certain labels that are becoming perhaps more or less popular, if you will. We also tried to balance comprehensiveness with complexity. And we tended to err on the side of simplicity. So we always kind of felt like less was more. If we could come up with less categories, that's sort of where we erred. And then finally, we tried to follow sort of generally accepted methodological practices in terms of response ordering for our categories. So for example, it's often the case that the largest population in a category is listed first, or maybe in alphabetical order. These are sort of general conventions that we try to follow. Okay, next slide. Okay, so we talked about the first recommendation, which was gender by default, and now I'm going to do my best to cover. This is what Kellen, Dr. Baker was going to cover, and unfortunately he couldn't be with today. So bear with me as I try to get through these. The actual precise recommendations for sex, gender identity, sexual orientation, and then Katie will take it from there, looking at the intersection DSD populations. Okay, next. Okay, so our first recommendation was gender by default. Our second recommendation was how to actually measure sexual orientation identity. And again, as I mentioned earlier, while we all sort of agree that there are three subcontracts to sexual orientation, identity, attraction, and behavior, we focused on identity. And again, we felt like the construct of identity was more aligned with outcomes that we were interested in measuring, things like health disparities, victimization, and those kind of things. So this question in the United States is pretty similar to a question that's been used successfully over the last decade in one of our very large surveys, which is the National Health Interview Survey, and then a somewhat more nuanced survey, which is the National Crime Victimization Survey. So the STEM simply reads, which of the following best represents how you think of yourself? Select one. The first is lesbian or gay. Second is straight, that is not lesbian or gay. Third is bisexual. And then this fourth category, this would only be presented if it was an automated data collection, number one. And number two, if previous to the sexual orientation identity question, the respondent had answered information on their race and ethnicity, and they had indicated that they were American Indian or Alaskan Native. And if and only if they met that condition, then they would actually see the two-spirit category. If they had answered something else, maybe white or African American, they wouldn't see this. This wouldn't be presented to them. And then finally, we had a free text if they said, I use a different term, and then they were encouraged to actually write in their information. So a couple of things that are slightly different to, again, the one that's been used in the National Health Interview Survey is, again, the two-spirit response option if you met those certain conditions and it was an automated instrument. And then second of all, the write-in option. Next slide. So what are some of the strengths of recommending this particular question? Well, first of all, we're not conflating it with other measures such as gender identity. It's only measuring sexual orientation identity. It clearly distinguishes among several sexual orientation identities, and it does allow for culturally specific identification if you meet a condition of indicating American Indian or Alaskan Native. It also allows for people who don't particularly want any of those labels, the first labels that were presented, they can write in whatever they'd like. Again, we felt like this was a pretty tested measure. It had been tested among a very broad range group of people, both English and Spanish speakers, and both folks from urban and rural areas. Next slide. So while it has its strengths, we also identify that there's also some weaknesses to this measure. Again, it does not reflect some of the aspects of cultural terminology. Like, for example, we didn't present same gender loving. We don't have things like queer or pansexual. Those who don't select one of the categories that are presented must write in their responses. And this can introduce bias into the process, something that at least one academic has called straightwashing, in that people may take these write-ins and put them in other categories that they had never really intended to be put into, because there has to be this cleaning and coding process with these open-ended. We also didn't include response options particular to, like I said, maybe younger respondents, labels like questioning. The response ordering does not reflect kind of the standard methodology. And it also has this sort of negating language with the straight category, where it says straight, that is not gay. But to give you a little bit of background on why that's there, over a decade ago, when the National Center for Health Statistics was doing lots of qualitative work to try to come up with this version, they found that there were some sexual majorities that kind of have a trouble thinking about this concept of sexual orientation because they are the majority. So they don't think about themselves as being straight or heterosexual, but they do think about themselves as not being gay. Okay, they want to disassociate themselves from the stigmatized or marginalized population. So the qualitative researchers found that putting that particular qualifier on there, straight, that is not gay, helped some of these non-sexual minorities find themselves in this particular question. Next slide. So while we recommend this question as ready to go, and we think it would yield good data, we recognize that there's also a rich area for future research. Again, as I just mentioned, alternative wording for the straight response option, perhaps we don't need that anymore. That was 10 years ago when they did that testing. It may be that things have changed enough in the United States where that qualifier is not really needed. If that was the case, then we could probably change the response options and start with the largest population first, which would be the straight population. Again, other labels should probably be tested that weren't included in our categories that are presented. And then again, we think there's probably definitely more research that needs to go on in adolescent populations. And then finally, there are many important surveys, at least in the United States, that don't just enumerate the single household respondent, but they're interested in knowing the demographics on all the household respondents. However, it's usually the case that a single household respondent is proxying that information for the other household respondents. So there is a lot of research that needs to be done about how comfortable a single household respondent is about answering questions about sexual orientation for household members other than themselves. So that's a very important area of research. Next slide. So let's skip over this and go to the next one. Skip over that one as well. Okay, so the next thing we're going to talk about is how to measure gender identity, moving away from sexual orientation. And there's several different approaches. One is the two-step approach that has been used successfully in the United States and other places. And it's had a lot of robust testing with a variety of methods and data collection modes. So that's in its favor. And also it's found to be that non-response is very low. And basically what it entails is two questions. One where one is asked to indicate what was their sex assigned at birth, perhaps on their original birth certificate. And then a second question about their current gender identity. And then using those two questions together, you're able to enumerate both cisgender and transgender populations, and also successfully enumerate, again, the subgroup that I talked about under the larger umbrella of what we call transgender. It allows for both people with a transgender experience and an identity to find themselves in this approach. Next slide. So this was our recommendation for how to measure gender identity. And again, it is this two-step approach. So the first question, what sex were you assigned at birth on your original birth certificate? And we kept the phrase original birth certificate, again, because folks can change their sex on their birth certificate. There is a little bit of a process, but you can do it in the United States. We wanted to make sure we were talking about the sex assigned at birth. Answers are female and male. Don't know or prefer not to answer. And then that question will be followed with the current gender identity question. Again, mark only one with female, male, transgender. And again, the same situation for indigenous populations for the current gender identity question, if it was a automated data collection, and if race and ethnicity was asked previous to this question, and if the respondent indicated they were American Indian Alaska Native, then they would be presented with the two-spirit category. And then lastly, is I use a different term, again, with free text. So What is slightly different from this two-step question, which has been used again in other surveys in the United States, such as the National Crime Victimization Survey, is the ordering. We put female first because this is the larger population group in the United States. And then second, again, the two-spirit category being available to those who indicated they are indigenous. Next slide. So before I talk about the strengths and weaknesses, I want to take a little bit of time to talk about the cross-tabulation. So the two-step question does allow for a very, very nuanced and robust de-aggregation of the different populations. So for example, you can identify cisgender women who have indicated female assigned at birth and female now, cisgender men who indicate male assigned at birth and male now, transgender women who indicate male assigned at birth but identify as female now, transgender men who identified as female assigned at birth but male now, and then people who actually use the label of transgender in the gender identity question, and then finally those with other non-binary gender identities who might indicate two-spirit or write-in. So all of those are available by using those two questions in conjunction. So strengths again, sorry, I'm a little bit in my head. The strengths are basically that this clearly distinguishes again between sex assigned at birth and current gender. The cross-tabulations allow for very robust de-aggregation, as I just mentioned. You've got the culturally specific identification, should they choose to indicate the two-spirit. And again, we felt pretty good because this had been tested among a diverse array of US populations, broad age groups, as well as urban and rural cisgender and transgender respondents. But again, it's not perfect. It's got its weaknesses. As I mentioned earlier, this is a forced choice. You have to measure. You have to select only one, and there are obviously many situations and respondents who might want to indicate both transgender and, let's say, male. We're recommending at this time that they wouldn't be able to do that. They would have to select one. Again, we recognize that there are new terms every day that are being used for gender identity, such as non-binary. And while one could write that in, that was not a category that we presented. Again, there's biases that may creep in with these open-ended. That's got to be cleaned and coded. And we also have heard from some respondents that asking sex assigned at birth can be very sensitive, especially for those who have transitioned. So, and maybe some cases where we're going to get item non-response to that. And we also recognize the fact in some situations it may be inappropriate to ask for sex assigned at birth, particularly in administrative situations. We also indicate that we also recognize that, again, in the United States, there are states that are now allowing for non-binary options. But again, because our focus was on adult populations, this wasn't currently an issue, but it's certainly something down the road that folks should be aware of. Next question, or next, yeah. I've covered that, so let's keep going. And covered that. And covered that. Great. So topics for future research. Like such orientation, while we feel pretty confident with this, recommending this measure, there's definitely things that need to be revisited and looked at. In particular, that while we talk about gender by default, we recognize the fact that using male and female is not necessarily the terminology for gender. Man and woman might have been better, and we did debate this as well. The reason that we finally settled on male and female was that empirical evidence and most of the two-step questions that are being used successfully are using male and female and not man and woman. However, I think, again, this is an area of research. Again, there are certain gender response options that maybe need to be added down the road, such as non-binary. And then finally, again, best practices, we need to do more information in terms of how these two-step questions work with very young populations, folks with a limited English proficiency, and again, like sexual orientation, how willing are a single household respondent to answer a two-step question on gender identity for folks in the household other than themselves, so proxy reporting. This is very important. Okay, next slide. Okay, and I think that's where I'm going to turn it over to Katie.
Thanks so much, Nancy. I really appreciate the chance to be here with you all today. And we'll be presenting specifically the findings from our committee with respect to identifying folks with intersex variations or differences of sex development. So just to kind of take a little bit of a step back and provide some additional context, recognizing that intersex variations are less familiar to most people than diverse experience of sexual orientation or gender identity. And also because of that, one of the challenges is that really in societal movements, but also in most surveys, intersex people are not seen or identified. And so people in the community will often joke that the I in LGBTQI stands for invisible. So let's just take a couple of moments to kind of level set for understanding what intersex variations are. So intersex is a complex experience at the intersection of biological and also social and legal factors. So biologically, intersex populations are really defined by biological variations, whereas sexual orientation and gender identity are not primarily related to biological differences. Intersex experiences are. And importantly, these variations can be of any sex characteristic. So most famously are folks who have genital difference, which is sometimes referred to as genital ambiguity, which is very uncommon. Somewhere around 1 in 2,000 or even fewer people will be born with obvious genital difference. But there are also variations in, for example, a person's sex chromosomes, their gonads, the extent to which their gonadal tissue is ovarian and or testicular, or their internal reproductive structures. And so when we take a much more inclusive definition of intersex variations, while it is true that overt genital difference is very infrequent, intersex variations overall have been estimated to be as high as 1.7% of a given population. But unfortunately, because we don't routinely collect intersex status, we don't actually have good prevalence numbers. These are really largely based on extrapolation from very limited data sets. As far as the legal and psychosocial factors, it's important to recognize that while clinicians in particular recognize that sex can exist on this spectrum or within a matrix, psychosocially and legally, most people are assigned and raised as either male or female at birth. There are some countries that have allowed for intersex people to be given a third gender designation on their birth certificate. However, in the United States, that is not available for infants in any of the current states. So practically speaking, every intersex person in the United States grows up with a binary legal designation, and then they may choose that in some states or on some federal documents to a non-binary designation later in life if they choose to. I think it's also important to recognize that really throughout westernized countries, the US and Europe as well, is that medical treatment has really emphasized a binary approach to assignment of gender. And what this has looked like in practice is that for many people, especially folks who were really older than, I would say, their early 30s, they're very likely to have grown up in an era in which no medical information was relayed to them regarding their diagnosis or their treatment history, including reason for early surgery. And early surgery has really been a cornerstone of intervention, especially for people with obvious genital difference. And so what this means is that people often have very limited information about their medical histories. They've been taught in some cases never to tell anybody about their medical history or their intersex status. And we know from surveys in clinical settings that people report and experience very high levels of shame and stigma related to their intersex status. And all of these pose really significant barriers to being able to identify and measure intersex populations. However, there have been a couple of studies that have shown that people with intersex traits are willing to disclose this information in a survey setting, particularly if they understand the justification for this. So the question then really becomes, how and where do we measure or identify intersex status in a survey? And part of the challenge here is that we don't really know actually for most people how they think of intersex as part of their overall experience. As a measure of sex relative to male sex or female sex, intersex status can be considered a demographic measure. However, intersex status is also associated with a range of medical conditions, and then which is unique from the other sorts of demographic measures that we might collect in a survey setting. There was a study that I was involved with, which had about 200 respondents, all based in the US and all adult. And what was really fascinating here is this survey was only open to people who were able to report having an intersex variation. And they chose this as part of their sex and as part of their medical status. But the majority of respondents also chose intersex as a component of their gender identity. So we see here in this particular sample, this sort of blurring of lines between demographics, medical history, and gender identity. The surveys that do currently assess intersex status in the United States primarily do so as an option, as a third option for sex assigned at birth on the original birth certificate, which again, as we've talked about, is not at all consistent with legal practices across the United States. And several community and advocacy groups have looked at all of these factors. And when I say community and advocacy groups, I mean not just US-based groups, but also groups, for example, in New Zealand, to look at this to recommend a separate intersex status question as a way of embracing and recognizing some of the uncertainty and frank ambiguity here. So the committee, as we worked through these sort of thorny issues, heard from experts and reviewed the available data, determined that intersex status is an important component of demographic status. It is also private medical information and is also an important aspect of a person's identity. And although there are barriers to disclosure, people appear to want to disclose their status. Because of these historical, legal, and medical factors that we reviewed, almost no person in the US is assigned intersex at birth. And to my knowledge, this is the case in other countries across the world as well. So we determined that it was inappropriate to assess intersex status primarily with an intersex response option for sex assigned at birth. However, it might be appropriate to include prefer not to answer or do not know options when asking about sex assigned at birth. So our recommendation from this conclusion to NIH was that when NIH seeks to identify people with intersex traits or differences of sex development across the settings we were tasked with examining, they should do so by utilizing a standalone measure that asks respondents to report their intersex status and should not add intersex as a third response category to a binary measure of sex. So the question that we then the question we then had to come to consider was, what measure should we be recommending for this standalone measure? And the challenge that we faced, which is unlike the rich research we had available to review for sexual orientation and gender identity, there was literally almost no evidence on the quality of intersex or DSD status measures. There was only one study that was actually community engaged and asked people on feedback on a specific measure. This was the closest of anything that we saw that came to cognitive interviewing and would not meet the standards of cognitive interviewing that most demographers would be looking for. And there were 3 studies that we were able to review that used variations of recommended measures from community groups in the Genius report, which you saw cited previously, in LGBTQ+ population-based surveys. So this is a very narrow application. But fortunately, these surveys found low non-response rates, but also found a wide range of positive responses. Some were ranging around where we would expect, about 1 to 2%, and some were as high as 8%. Now, the only caveat there is we know that intersex people are more likely to also identify as not having a cisgender or heterosexual experience. So it is likely that intersex folks are overrepresented in LGBTQ+ populations, but we don't we don't actually know this, and it makes it difficult to interpret the validity of the measures these surveys were using. The questions that we saw used ranged pretty widely. The first was the most comprehensive, but also the clunkiest, which made some of the folks on our committee with more survey experience than I, as a clinical psychiatrist, made their eyes twitch a little bit, which is, have you ever been diagnosed by a medical doctor or other health professional with an intersex condition or a difference of sex development, DSD? Or were you born with or developed naturally in puberty, genitals, reproductive organs, or chromosomal patterns that do not fit standard definitions of male or female? So what we saw is the strength of this measure is the definition is really embedded in the question. It does not rely exclusively on a medical diagnosis, which has the problem of limiting access for folks who may not have been able to receive a diagnosis from a physician, but again, is very long and clunky. So then we saw here in the next two bullets, we saw essentially breaking that longer question down into two different components. One is just, were you born with a variation in your physical sex characteristics? And the other was, have you ever been diagnosed by a medical doctor with an intersex condition or DSD? So as clunky as this question was, this is really the question that we felt had the most robust support for it. Particularly because this was the question that had been recommended by the Genius Report and was consistently recommended by community and advocacy groups in English-speaking countries, which was the very long, sort of fully read out statement with two options, yes or no, and then a don't know, and a prefer not to answer. However, we recognize that the quality of evidence that supports this recommendation is pretty limited. And so we spent a lot of time, frankly, almost as much as we did on working through some of the available evidence to identify where we need further research. Specifically, we really do need further research on the use of a single item intersex DSD status question. We need testing of the relative quality of the three measures that we looked through. One of the issues that came up is that people in community use very different language. Some folks are much more comfortable with intersex, others are more comfortable with DSD, and we needed to understand the effects of these different terms, as well as including definitions in question stems or supplemental texts. Looking specifically at the prevalence of intersex as a gender identity among folks with intersex traits. And then, as Nancy indicated before, proxy reporting, for some of the same reasons we've seen previously, is important for understanding intersex DSD status, but it's also uniquely important for this population because people with intersex variations are most frequently identified during childhood. And we know that the parents of children with intersex traits have really unique and specific psychological and social needs, as well as health needs. So there's a particular import here, especially in clinical and health survey related settings. So in conclusion, as we wrap up our presentation from today, everyone deserves to be counted, including the sexual and gender minority populations. Standardized questions for sex, gender identity, and sexual orientation will enable comparison across studies and ensure that our data systems better represent all individuals' characteristics, identities, and experiences. You're able to link to the report if you're interested in reading it in its entirety. We would certainly welcome and be impressed by that, although there are some excellent summaries available as well. And if you're interested in speaking with someone at the National Academy specifically regarding the report, these are their email addresses, but you're also welcome to reach out directly to myself or to Nancy.
Thank you very much for a fascinating and very informative talk. We have a few questions. One of them you've just answered, which was, would it be possible to access the report? So thank you for that link. And related to that question, will it be possible to see these slides and access the recording? And of course, we publish these on our YouTube channel in due course, so that's also a yes. So I've got a little cluster of questions. I've got two or three which I think are fairly straightforward, which are about sort of measurement of items. So maybe you could take those quickly first. So for the sex and gender questions, Sierra asks, was there a don't know or prefer not to say explicitly displayed, or was this only available when the participant attempts to skip?
So I think I can handle that one. I believe in an automated instrument, we would not display prefer not to answer, don't know. I'm going to look real quick here. Katie, is that your record? Yes, yes. So use a different term is displayed. The don't know and prefer not to answer are not displayed in an automated. Now, if it was, let's say, a paper and pencil questionnaire, we probably might present those.
Okay, thanks for that clarification. Eileen asks, on the sexual orientation recommended question, I know that some of you some questions separate out gay man from gay woman / lesbian. Was this something that was considered, and was there a reason that your approach was preferred?
So we made the conscious effort. Let me back up for a second. There are some surveys, in particular the National Health Interview Survey, they ask a sex question before they ask sexual orientation. And if you indicate female, then they only show you lesbian. And if you indicate male, they show you, I think it's gay. We specifically did not recommend that, that it not cue off of an earlier sex question. So we've got, I'm trying to look exactly where we have lesbian or gay all on the same response category.
Okay, thank you for that. A question from Lucienne. Can we filter using attraction to then ask sexual identity only to those who respond that they are not only attracted to people of the same gender, or is this inappropriate?
It's not something that we discussed. Again, we focused on identity and not attraction. I personally think that's probably not a great screener to use, but it's certainly not something that the committee debated, unless I'm forgetting something, Katie.
No, that's my recollection as well.
Okay, thank you. A slightly chunkier one here now, so I'll just summarize it. The question about asking gender in Latin American and Caribbean contexts. Valerie says they've run into problems where people can get offended when asked what their gender is, as though it's insulting to them that interviewers can't tell just by looking at them. This has led to increased non-response and even leads to higher break-off rates or negative orientation towards the survey for the remainder of the interview. Any recommendations on how to approach this issue? Thanks.
So again, given that our scope was the adult English-speaking population in the United States, this is not something that the committee debated much. I think I've probably heard similar things. And again, we certainly recommended there needs to be in the United States much more testing among populations where English is not their first language, and Spanish being the most populous spoken language in the United States, that's usually where our resources go first. But I don't think I have much more to comment on that. Katie, do you have anything else?
No, I don't. The only other thing that I can think of is having some information for participants about why you're asking that question and helping people understand that it's a question that's routinely asked of everybody, but that's really coming more from clinical practice than it is from demographic research.
Thank you. Nick says, you recommend that gender should be the default target for measurement. Sorry. Default target for measurement, but you also say that the link between gender and sex can only be understood by collecting measures of both. What is the evidential base for collecting gender by default rather than sex, and for suggesting that sex should only be measured for specific purposes, for instance, medical?
So I'll try to get this one, and Katie can back me up. I think the reason for gender by default was that one's gender identity is really the construct that is driving outcomes in life. Okay, it's not necessarily what their sex assigned at birth was. So given that, we felt like that is the construct that is more important to be measured versus biological sex or sex assigned at birth. I'm not sure if I remember the rest of the question or not.
What's the evidential base for collecting gender by default and for suggesting sex only to be used for medical?
Well, again, I mean, that's my best guess.
Okay, thank you.
Yeah, sorry, I can just chime in here with two other points, I think, to Nick's question. I think that we as a committee were pretty heavily informed in that this conclusion by review of and familiarity with population health research, specifically looking at the factors that drive population research, looking at the factors that are actually driving outcomes among different populations, and really understanding those to be related to social and structural influences. I think at the same time, we did go through an exercise where we were actually trying to generate algorithms that would help users determine when and when not to ask the sex question. And we found that it was so frequently that you could come up with a justification for including sex that it really wasn't a useful exercise. So from an application perspective, I think really what we're hoping is that people will take these measures up to just be thoughtful and intentional about when they're asking sex as opposed to gender, and not only relying on sex as a way to capture what is essentially related to gender, if that makes sense.
Okay, thanks. There's a little cluster of questions, all really based around the idea of what do you see as being the level of take-up for this in official statistics, and are the plans to roll it out to other bureau surveys? And supplementary to that, Jerry Nicholas asks, for example, have you got population data on gender that you can be used for survey weighting?
So I can say that in the United States, two of the pivotal data collections, the decennial census and the American Community Survey, right now are not collecting sexual orientation and gender identity. However, I have spoken with the folks over, I used to work at the Census Bureau for 3 decades, and the folks over there are having a very robust research agenda. And there has been at least one federal agency that has approached the census about adding sexual orientation and gender identity to the American Community Survey. So the American Community Survey would be the gold standard of trying to get the best population estimates for weighting purposes. I mean, there are other surveys that are doing it, like the National Health Interview Survey. So they could probably use those, but these are much, much, much larger. The American Community Survey is really probably the one. And so, we'll see. In a year from now, maybe it will be on there.
Thank you. You mentioned in passing this issue about proxy reporting. Lisa asks, are you aware of any research that's been or is being carried out on proxy reporting of gender identity since you published the report?
Not since we published the report. I know that is one of the number one, I just mentioned the research agenda that the ACS is putting together. That is probably the number one thing that they are looking at. Previous to this report, there was a special issue in the Journal of Official Statistics, and there's a nice article that covers this topic. It's qualitative, it's not quantitative, but certainly it was a very robust qualitative piece of research that used both cognitive interviews and focus groups. And I think the main takeaway there was it is possible that household respondents are willing to do it. There are differences to some degree among the relationship of the household informant to the people that they're answering for. And we've seen that in one little test that we did. But since the report's come out, I haven't seen anything, but I think that's certainly something that we're going to see hopefully fairly soon from the ACS research.
Okay, and a question from Rana. Any recommendations about the reporting of these data?
Okay, it's kind of a broad question.
Presumably, I'm not sure if that's in relation to whether are small numbers. I'm not really.
Right. Well, certainly we're aware that while the two-step question does allow for really nuanced disaggregation and teasing out, we also recognize the fact that, again, the sample size, the cell sizes may just be too small, right? And the disclosure avoidance may necessitate, putting together some of these categories. I think it just depends on the particular data collection and the sample size.
Okay. Well, we've ticked round to 5 o'clock. So I'll thank you all very much for your participation and take this opportunity to once more thank our speakers. Sorry if I didn't manage to get round to your questions, all of your questions, but thank you very much for putting them in the box nonetheless. And we look forward to welcoming you again very soon to another one of our survey methods seminars. But in the meantime, thanks very much once again and good afternoon.